Good afternoon, everybody. Thank you for joining us for today's Lunch and Learn. My name is Taylor, and we are going to have a little heart to heart today presented by the Office of Health Promotion. And so, as I mentioned, I work for the Office of Health Promotion. And for those of you who are unfamiliar with our office and what we do, in a nutshell, we proactively educate the SHSU community about health and well-being. And our office falls under the umbrella of the Student Health and Counseling Center. However, we do not provide medical or mental health services, but some of our programs that we do provide include Elevate, which is SHSU's Healthy Campus Initiative for students, faculty, and staff. Pets for Recovery, which is our collegiate recovery program that provides social support and sober activities for students in recovery and their allies. Peer Health Ambassadors, which is our student leadership organization that works to promote wellness through fun and creative events. Program Request, which is our outreach program that allows anyone on campus to request a staff member from our office to come and deliver a program or presentation to a class, meeting, event, or residence hall. Some of our signature events that we host every academic year that our office is well known for are flu shot clinics, Fresh Check Day, health fairs, and Wellness Week and Get Yourself Tested events. For more information about our office and our upcoming events, you can visit our website at www.shsu.edu/OHP, or you can follow us on Instagram and Twitter at SHSU_OHP. And so this semester, we will be running our Wellness Rewards program. And to participate, all you need to do is attend one of our events and your name gets entered into a drawing for a Fitbit Versa. You will receive one entry for each event that you attend. And if you attend at least 3 events, you'll automatically be able to win a small prize. And so today's Lunch and Learn is going to be considered one of those events. I'd also like to mention that the first 10 students to register and attend can receive a free meal voucher from OHP as well. And so if you're interested in registering for any of our events, you can visit our website and go to our calendar and you can register there. So our goal for today is to educate students on the importance of heart health and what they can do starting now to prevent heart disease in the future. Our objectives are going to be to identify risk factors associated with heart disease, recognize some symptoms of heart disease, and then learn to make healthy choices to prevent heart disease. So what actually is heart disease? Heart disease describes a range of conditions that affect your heart and can include blood vessel diseases such as coronary artery disease, which is the most common type of heart disease, and it kills almost 400,000 people a year. And about 18.2 million adults aged 20 and older have coronary artery disease, and about 2 in 10 deaths from coronary artery disease happen in adults less than 65 years old. And then we have heart rhythms or arrhythmias, which occur when the electrical impulses that coordinate your heartbeats don't work properly. It can cause your heart to beat too fast or too slow or irregularly. You have heart valve disease, which is one or more of the valves in your heart doesn't work properly. You have disease of the heart muscle, which can be acquired or hereditary. And this condition makes it hard for the heart to deliver blood to the body and can lead to heart failure. And then you have heart infection, which is kind of exactly what it sounds like, but it can be caused by bacteria, viruses, fungi, etc. And heart infections aren't always common, but if you do happen to get a heart infection like endocarditis, they can be very dangerous and life-threatening. So symptoms for heart disease can vary depending on the heart disease. And so for many people, chest discomfort or a heart attack is the first sign of heart disease that they have. And it is different. Heart attack symptoms are different for men versus women. And some of those symptoms can include chest pain, pain or discomfort in the jaw, neck, or back, weakness, lightheadedness, nausea or cold sweat, shortness of breath, dizziness. And with heart attacks in the United States, someone has a heart attack every 40 seconds. And every year, over 800,000 Americans have a heart attack. And of these, 605,000 are a first heart attack, and 200,000 happen to people who have already had a heart attack. And so about 1 in 5 heart attacks are silent. And so the damage is done, but the person is not aware of it. For some of our other heart disease conditions, with arrhythmias, you could feel a symptom can be fluttering in your chest. You can have a racing heartbeat, which is also called tachycardia, a slow heartbeat, which is bradycardia. You can feel some chest pain or discomfort, shortness of breath. You can have fainting or near fainting, which is also called syncope. If you have a congenital heart defect, you could have pale gray or blue skin or cyanosis. You might feel some swelling in the legs, the abdomen, or areas around the eyes. Sometimes heart defects are common in infants or can be found in infants, and they might have a shortness of breath during feedings, and they might not have proper weight gain. And so if you're feeling symptoms for a diseased heart muscles, for something like cardiomyopathy, some of the symptoms are very similar, with breathlessness, swelling of the legs, ankle, and feet, and the dizziness. And so if you notice, a lot of the symptoms throughout the different types of heart disease are all very similar. So, anything to do with the chest, dizziness, sometimes your heartbeats don't feel correct or feel right, shortness of breath. And so all of these can lead to a different type of heart disease. So if you definitely feel like if you're feeling any of these symptoms, or if you know somebody who's feeling these symptoms, you should seek medical help. If you think somebody's having a heart attack, you should call 911 immediately, or see a doctor for some of these symptoms so that further disease can be prevented. So who does heart disease affect? Essentially, heart disease can affect anyone and everyone. It's the leading cause of death for men and women and people of most racial and ethnic groups in the United States. A scary statistic is that one person dies every 36 seconds in the United States from heart disease, and over 600, close to 700,000 Americans die each year. And so for men in the United States, heart disease was considered for 1 in every 4 male deaths. Heart disease is the leading cause of death for men of most racial and ethnic groups in the United States, including African Americans, American Indians or Alaska Natives, Hispanics, and whites. For Asian American or Pacific Islander men, heart disease is second only to cancer. About 1 in 13, or 7.7%, for white men, and 1 in 14, or 7.1%, in Black men have coronary artery disease, and about 1 in 17, or 5.9%, Hispanic men have coronary artery disease. And half of the men who die suddenly of coronary artery disease have no previous symptoms. And so even if you don't have any symptoms, you can still be at risk for heart disease. And heart disease costs the U.S. over $200 billion a year, which includes healthcare services, medicines, and loss of productivity due to death. Heart disease is also the leading cause of death for women in the United States, killing nearly 300,000 women in 2017, or about 1 in every 5 female deaths. So for college students, do you think it can affect college students? Typically, heart disease might seem like an older person disease, but in the chat, feel free to answer if you believe heart disease affects college students.
Did you see my message? I said, of course.
Yes, I see the chat now. So absolutely. So college age students are at a higher risk than they might realize. 18.2 million adults age 20 and older have coronary artery disease, and 1 in 16 women aged 20 and older, or 6.2%, have coronary artery disease. Some studies suggest that college students and their healthcare providers should be paying more attention to heart disease risk factors. And as the number of cardiovascular disease risk increases, so does the potential for clinical consequences such as heart attack or stroke. And so preventative steps such as screenings are very important. And the American Heart Association has estimated, for example, that the life expectancy can be raised by 7 years if preventative measures are taken early. And studies also show that young adults, particularly young men, often overlook risks of heart disease and high blood pressure. It's also recommended that screenings for heart disease can begin at the age of 20, and it's recommended by health and medical experts. I also think it's important to note that college students also might be at higher risk more than they realize, because once they get to college, they aren't necessarily under their parents' roof or their control anymore. And so it can kind of go into risks associated, like they might be experimenting with drinking or smoking. They have poor diet because they can eat whatever they want now. And some of the risks associated with heart disease are uncontrollable. So we know that age, sex, and genetics, that's not really controllable. So with age, growing older increases your risk of damage to narrowed arteries and weakened and thickened heart muscles. We know that with sex, men are generally at a greater risk of heart disease, but the risk for women increases after menopause. Family history can play a large part in heart disease or genetics. Obesity, carrying extra weight, can put stress on your heart, and more than 1 in 3 Americans and nearly 1 in 6 children and adolescents have obesity. Diabetes, which can be controlled or uncontrolled depending on the situation, can cause sugar to build up in the blood, and this can damage blood vessels and nerves that help control the heart muscle. And so more than 1 in 10 people in the United States have diabetes. Physical activity is really important and can be controlled. And staying physically active helps keep the heart and blood vessels healthy. And only 1 in 4 adults meet the physical activity guidelines, which is about 150 minutes of moderate to intense activity per week. And then healthy uneating patterns, which is also pretty common amongst college students because they do have that freedom to pick what they want to eat. And so some of these are uncontrollable, but if you can start controlling those risk factors now that you can, it definitely helps in the long run. So some preventative measures to take. So obviously don't smoke, maintain a healthy weight, eat a healthy diet, exercise regularly, prevent or treat other health conditions, and practice good oral health. This one, the oral health, kind of gets lost among people sometimes, but it's important to brush and floss your teeth regularly and have dental checkups so that you don't get any type of infection that can enter your bloodstream and travel to your heart. Some studies also have shown that gum disease can be associated with heart risk. It's not a solid fact, but there are studies that think that it has some risk factors, or other poor dental health choices might cause, infection in the bloodstream, which might not infect your heart, but you can have infected heart valves. And so oral health is really important, and it's an easy preventative measure for college students to take. It's also important that even if you already have heart disease or coronary artery disease, it's not too late for you. Any of these lifestyle changes can help you kind of come back and work on some of your heart disease issues, like coronary artery disease or high blood pressure. And so these things can be, helped and reversed if you do take some of those preventative measures. So now we're going to talk about a heart healthy diet. And so for college students, this can be kind of easy to control. So you can control your portion sizes. So maybe if you go out to eat with your friends, or you order DoorDash, because we're not really supposed to be going out a whole lot since we're in a pandemic. It kind of helps to maybe portion your food when you get it, like you put half of the food on your plate and then you store the other half for another meal, so you're not eating it all at one time. It's good to eat more vegetables and fruits. These are good sources of vitamins and minerals. And they're also low in calories and rich in dietary fiber. Some good fruits and vegetables to choose would be fresh or frozen vegetables, low sodium canned veggies, or canned fruit that's packed in juice or water. Some fruits and vegetables to limit would be coconut, vegetables with creamy sauces, fried or breaded vegetables, or canned fruit packed in heavy syrup, because that can contain a lot of sugar. I know for college students, sometimes it's kind of hard to shop healthy on a budget. And so sometimes you might want to buy fresh produce, but you're worried that it'll go bad, and that can be kind of a waste of money. Buying frozen vegetables or fruit can be beneficial, because that's one way to portion out, but when it's frozen, they do hold a lot of their nutritional value. And so if you have them in a bag in a freezer, you can kind of portion out what you need each time, and so that you're getting the most out of your money that way. Eating whole grains is a good source of fiber, and that can play a role in regulating blood pressure through heart health. And increasing the amount of whole grains in a heart healthy diet by making simple substitution for refined grain products can be a big help. Some good products to choose would be something like whole wheat flour or whole grain bread, high fiber cereals, whole grains such as brown rice, barley, and buckwheat, whole grain pasta, and oatmeal. And some products to limit or avoid would be white refined flour, white bread, muffins, frozen waffles, cornbread, donuts, things like that. It's also important to limit unhealthy fats, and limiting how much saturated and trans fat you eat is important to help reduce your blood cholesterol and lower your risk for CAD. A high blood cholesterol level can lead to buildup of plaque in your arteries, also known as atherosclerosis, which also can increase your risk of heart attack and stroke. And so the American Heart Association has guidelines for how much fat to include in a heart healthy diet. And so for saturated fat, it should be no more than 5 to 6% of your total daily calories, or no more than 11 to 13 grams of saturated fat if you follow a 2,000 calorie a day diet. And you should avoid trans fats as much as possible. And you can reduce the amount of saturated fat in your diet by trimming fat off your meat or choosing lean meats with less than 10% fat. You can also add less butter, margarine, and shortening when cooking and serving. Some good fats to choose if you are substituting butter or margarine would be something like olive oil or canola oil, vegetable and nut oils. Margarine, it can be trans fat free, but you should also use margarine in the right kind of portion control. And then you should avoid fat, lard, bacon fat, gravy, cream sauces, and non-dairy creamers. So you can also eat low-fat protein sources. And so this is like lean meat, poultry, fish, low-fat dairy products. And then eggs can be a good source of protein as well. Some good sources of protein would be low-fat dairy products, such as skim or low-fat milk, yogurt, and cheese. Eggs, fish, especially fatty cold water fish, such as salmon. Skinless poultry, so if you're eating chicken, it's best to peel the skin off the chicken before you make it. Legumes, soybeans, soy products, such as soy burgers and tofu, and lean ground meats. And some proteins to avoid would be full-fat milk and dairy products, organ meats such as liver, fatty and marbled meats, spare ribs, hot dogs and sausages, bacon, or fried and breaded meats. It's also really important to reduce sodium intake. Sodium can contribute to high blood pressure, which is a risk factor for heart disease. And so reducing sodium is really important in a heart healthy diet. Healthy adults should have no more than 2,300 milligrams of sodium a day, which is about a teaspoon of salt. And then most adults ideally have no more than 1,500 milligrams of sodium a day. And so although reducing the amount of salt you add to food at the table or while cooking is a good first step, much of the salt you do eat comes from canned or processed food, such as soups, baked goods, and frozen dinners. And so eating fresh foods and making your own can help control the amount of salt that you're eating. And so some low salt items that you can choose are herbs and spices. So when you are cooking, it's best to leave the salt on the table and to cook with your herbs and spices instead, and then kind of just salt a little bit as needed once your food is prepared. There's a lot of good options for salt-free seasoning. You can use reduced salt products from the grocery store, or reduced salt versions of condiments like soy sauce or ketchup. It also helps to plan ahead and create daily menus. So this is where you can meal prep. So if you meal prep ahead of time, you control what you eat throughout the week. And it also kind of helps save money as well, which I know is very important for college students. And one of the most important things is to allow yourself an occasional treat. So it's okay to indulge every now and then, and it won't derail your heart healthy diet, but just don't let it turn into an excuse for giving up your healthy eating plan. So now we're going to move into a little activity called Why So Salty. So if you go to polev.com/healthpromote633, there is a little activity that lists several food items. I'll let you list them and you'll put them in the order of least amount of sodium to most amount of sodium for each item. And then I'll kind of go over the correct order of how they should be and about how much sodium is in each item.
It's most salty to least salty.
Least salty to most salty.
Thank you.
You're welcome. And there should be little arrows by the food items that lets you move them into the place that you want them to be.
Okay.
Okay, did everybody have a chance to respond?
I did.
Awesome. Okay. So on my end, it's showing that the Starbucks drink, which is a salted caramel frappuccino, as the least, and then followed by the fried rice from Panda Express, the chips and guacamole, the Chick-fil-A burger, the Chick-fil-A sandwich, the Popeyes chicken sandwich, the slice of pepperoni pizza, the canned chicken noodle soup, and then the large French fries. Okay. So the correct order is actually first, with the least amount of sodium, is the large Whataburger fries. So that has about 350 mgs. Second is the Starbucks salted caramel frappuccino, which is the size, a grande size, and that's 360 mg. Third is the Moe's chips and guacamole with 670. Fourth is the one slice of pepperoni pizza, which is 680. Fifth is the Panda Express fried rice, which is about 1 cup, which is 850. Sixth is the Chick-fil-A chicken sandwich at 1,350. Seventh is the Popeyes chicken sandwich at 1,443. And coming in with the most sodium is the can of Campbell's chicken noodle soup, which has about 1,580 milligrams of sodium. So I know the Campbell's kind of can get you, but the processed soups and canned soups have a lot of sodium. And so that's why it's always best to come back and make your own, because that is way too much salt to be consuming, especially when it's only about a cup with that much sodium.
Wow.
Yeah, it's a lot, right?
That's crazy. I thought it was the fries.
Yeah, and even that's even just a large fry. But one helpful tip about eating fries is that if you do get fries from a fast food restaurant, this can really annoy some of the workers. But if you order fries, you can order fries without salt, and they will make them for you without salt. They'll probably be fresh and hot, because most of the fries that they do make are already salted, and so they'll have to make a new batch. But you can order fries like that from fast food restaurants.
Right. That's right.
So now we're going to move on to smoking and heart disease. So smoking is a major cause of heart disease. It can raise your triglycerides, which are a type of fat in your blood. It can lower your good cholesterol, which is also known as your HDL, or high density lipoprotein. It can cause your blood to be sticky and clot. It causes plaque buildup, which is fat, cholesterol, and calcium and other substances. It can damage cells that line blood vessels, and it can also cause thickening and the narrowing of blood vessels. I also want to talk a little bit about secondhand smoke and heart disease. And so just because you might not smoke, but if you're around somebody that does smoke constantly, this can also affect you. Breathing secondhand smoke harms your health, and it can cause you to also have coronary heart disease and stroke. Secondhand smoke causes nearly about 34,000 early deaths from CAD each year in the United States among non-smokers. And non-smokers who breathe secondhand smoke at home or at work increase their risk of developing heart disease by 25 to 30%. And secondhand smoke increases the risk for stroke by 20 to 30%. And each year, secondhand smoke exposure causes more than 8,000 deaths from stroke. And breathing secondhand smoke interferes with the normal functioning of the heart, blood, and vascular systems in ways that increase your risk of having a heart attack. Even briefly breathing secondhand smoke can damage the lining of your blood vessels and cause your blood to become stickier. So just because you might not be smoking, it's good to just kind of avoid situations where you are around it, because it can definitely have a negative effect on your heart health. Something easy for college students to do is exercise to get that preventative action going. Exercise can raise your good HDL levels, helps you lose weight or stay at a healthy weight. It might lower your blood pressure, control your blood sugar, and it can also be really good for your mental well-being and stress relief. And so lack of exercise can play a big role in having an unhealthy heart. And so not only does it lead to high blood pressure from plaque buildup, but it can increase your chances of becoming obese or overweight. And being more active doesn't have to be hard. Any activity that raises your heart rate can help your heart. So doing something that you enjoy, such as walking, maybe like cycling or swimming or dancing, that can all help. I know Zumba can get your heart rate going. And so to get and stay healthy, you should do activity at a level that is right for you. So it can be either moderate or vigorous. So for moderate activity, you should do at least 2.5 hours a week. And so one way that you can do this is to be active 30 minutes a day, at least 5 days a week. So moderate activity means things like brisk walking, brisk cycling, or ballroom dancing. I know, so right now the weather's a little gloomy in Huntsville, and it's not cold but not warm. But walking around campus for 30 minutes in a moderate pace can be a great way to get some of that activity. You could also ride a bike or go dancing. Anything that can raise your heart rate can be included. Some vigorous activity, which should, if you do prefer vigorous activity, which is about 1 1/4 hours a week, would be active 25 minutes a day, at least 3 days a week. And that can be like running and jogging, fast cycling. This is when you breathe rapidly and your heart beats much faster with this kind of activity. And to lower your risk, be active for longer than 10 minutes at a time and try to do aerobic activity for an average of 40 minutes. And you can do this at least 3 to 4 times a week. Aerobic exercises are some of the exercises that I mentioned earlier, like walking or jogging. I also want to important to note that if you are not currently active but would like to become physically active, you should talk to a doctor before you start. It's just very important to kind of get a feel on how much activity you should start with and your intensity versus going full on in, because that could cause you to have other issues as well. So some campus resources for students to work on their heart health is, of course, the Student Health Center, Elevate, which is our Healthy Campus initiative I mentioned earlier, the SHSU Food Pantry, which has distributions throughout the semester for students, the Counseling Center, which is good for some of that mental health and stress relief, and of course our office with the Office of Health Promotion. And Rec Sports. So Rec Sports does a lot of classes that you can do virtually. I know they're currently offering in-person classes now with proper social distancing measures in place. And so there's a lot of campus resources available to students who do want to take those steps to prevent future heart disease and to stay on the healthy track.